I asked Dr. Gabow if she would be willing to come, because I have to tell you this story. Patty remembers this. I worked with a representative around a healthcare reform bill, and it was my first experience being down at the Capitol. And I was amazed at how often people actually gave the appearance of listening to my opinion because I was a practicing doctor. And I set an appointment and met with Patty, and I said, you know, people are actually listening to me, and I feel like it's a big responsibility. But maybe this is my chance to really do something transformative in medicine. What do you think I need to do to really do something? And Patty said, well, there are 3 things you could do. The first is that you could run a successful business. But since you've never run a business, it may be a little late for that. She said, you could become the spokesperson for an organization that has a good reputation, and you might consider Larissa. She pointed me in that direction. She said, or you could run for office, but you know, I don't think Diana DeGette will be out of there in some period of time, and who's your senator, Romer? No, I'm not sure you could take on Romer. Maybe you could run for House. So last November, when I heard that Romer was resigning to run for mayor, I thought, this is my chance. So I tell Patty that I have her to thank for me being in this position. And when a patient said to me, I said, not a patient, a constituent actually from Centennial said, you know, why are you in the legislature? The government can't do anything about health care. I said, I don't think the government can either. And she said, well, then why are you a senator? I said, well, because when I was just a doctor, nobody listened to me. So I asked Dr. Gabow if she would come and talk to you all about, because she's obviously been an inspiration to me, about why she thinks this is important and what she would suggest to all of us. Thank you, Dr. Gabow.
Well, thank you. I think I may have encouraged you, but now you can inspire all of us by where you are. First of all, I apologize for my voice. I have spastic dysphonia. Many of you probably know the treatment is Botox. Does nothing for my wrinkles, but I'm sure I have beautiful vocal cords. And when I first get it like now, I'm in my breathy phase. I do think that as physicians, we have a big challenge ahead of us. If we think back to when Medicare and Medicaid came in, physicians opposed it, and organized medicine opposed it. And I hope we're not going to be at the same place now with healthcare reform, and that we're going to, I hope we don't stand as barriers to changing American healthcare, but rather we get out there and lead the parade. I personally think that our healthcare system not only can't be sustained, but shouldn't be sustained. I think we have several very serious issues that we all have to think about. What is the solution? The first is we can't leave 50 million people outside the tent. I mean, it's terrible that we're the richest country in the world. Every other developed country has figured out a way to cover everyone. And I just think that this is something we should all be ashamed of as having. The second thing is we can't be spending 17 to 18% of our GDP on healthcare. It's robbing our children of education. It's robbing the country of infrastructure, and we shouldn't have to spend that much to have quality. I really don't believe that we need to. Now, the problem is that it's a $2.5 trillion industry, and by 2020 it's going to be a $4.2 trillion industry. That's the 5th largest country economy. If what we spent on health care were compared to the GDP, we'd be right after France. And when you have something that big, it's really hard to change. So many people, including all of us, are making a lot of money off of the current dysfunctional system. And everybody who's in the healthcare business is benefiting from the dysfunction. And that's why it's really hard for government to change it, because as soon as you want to change one thing, there's a group that don't want you to change it. And that's something as physicians we have to think about. The third issue is spending all that money. We still don't have great quality. Every 2 years, the Commonwealth Fund does a comparison internationally to the developed countries on 37 variables that have been attained. These are not some theoretical targets. And we get a grade of 65 out of 100. And we haven't budged since they first started doing that. That's a C. So we're spending twice as much and we're getting a C. Maybe that's not a C anymore as people grade on the curve. But it's some grade that's not good. And then the final thing that disturbs me, as much as all those others, are the huge disparity that we have by ethnicity, by social economic class, and even more by geography. You know, if you're poor and you're living in Texas, or Alabama, or Mississippi, that is very different than being poor in Massachusetts, in Minnesota, in Iowa. And I think as Americans, we really have to ask ourselves, and as physicians especially, we have to ask ourselves, is it acceptable that where you live should determine if you live in America? And I find that very disturbing that we accept that. So these are big issues, and I don't see the leadership that we need to have change. I'm glad Irene has taken this on, but we all have to take this on, and we all have to own this. And we need to occupy healthcare or something. I don't know where exactly we put our tents, but it's someplace. And I think physicians cannot stay quiet about these issues any longer and feel that we've honored our profession. So I'm not here to organize a movement. I'm here to say Irene's doing a good thing for us, but I think we need to all think about this. These are serious issues, and I hope that as professionals and as physicians, we're in a noble profession, and we can't forget that, and we have to lead to a noble end, I think. That's a good thing.